Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what's on our agenda for today, Heather?
Today, I'm really excited that we have Dr. Reza Sanai, the co-CEO and founder of Picasso MD. Reza and I first met at a previous job of mine and got to work together. And so I was really thrilled that he agreed to come on the show. So,
Cool.
yeah, super cool to have people from my past join us here. But Reza developed the concept for Picasso MD when he was co-managing partner of CardioCare. He's a cardiologist. Which is an independent cardiology practice in the DC area. He has been consistently recognized as one of Washingtonians' top doctors for optimizing patient experience through novel workflows and experiential design. Obviously, Picasso MD being his
experiential design is very Picasso-like.
Yeah, for sure. And definitely improving patient experience. So, which we're going to learn about in the show today. He went to George Washington University Medical School, where he served as chief cardiology fellow for 2 years before joining his medical practice. So, yeah, Dr. Reza Sanai has got quite the resume.
Right on, right on. Do you know Picasso painted in 4 dimensions? That's what made him so weird.
I love that.
Yeah, yeah. He
I'm
looked
a
at
big
things.
I'm a big fan of Picasso.
Yeah. But before I get any weirder, let's without further ado, here's our conversation with Reza Sanai from Picasso MD.
Hi, and welcome to Healthcare Uprising podcast. Today we've got Reza Sanai, MD, and co-CEO and co-founder of Picasso MD. Welcome to the show, Reza.
Thank you for having me.
Great. So let's first get a little background on you. You've got kind of a clinical background as a doctor. You're now a startup co-founder. Can you share with us just a little bit about the kind of work that you've done in both these spaces and kind of set us up for how you kind of came to be today with Picasso MD?
Yeah, I'm a cardiologist by training, so had been practicing for a little over a decade, and then kind of like many people who live and breathe their profession, you kind of learn some of the inefficiencies of what you're practicing, and then for me specifically as a provider who kind of like prided myself on being a provider advocate and a patient advocate, I felt like just I wasn't practicing at the top of my license, and there was just a lot of inefficiencies. So, like the origin story of Picasso kind of really came out of my own frustrations, at in day-to-day practice, and actually looking for other solutions that I thought would naturally exist to kind of help with some of those inefficiencies, and realize that there's just a dearth of opportunity for specialists like myself who really cared about the healthcare system and the patient journey and doing right by the patient, et cetera, et cetera. There was really no real clear path for me to have a larger voice and outside my practice. So just naturally evolved to a point where I just got more and more frustrated, and then eventually got to a point where I started putting some thoughts on a piece of paper, and eventually got it to taking it from a piece of paper to actually going, creating a platform along with my opposite team members. But yeah, that's kind of the journey, like many, is just kind of seeing and realizing that, man, there's a lot of opportunity in the world I live in.
Yeah. Yeah, that's kind of it's the interesting, I would say, red thread, as I like to call it, on this show, and with so many people that we meet like you, is that you're solving for a problem that didn't have a solution, right, in your space. And so like kind of born from your own personal experiences. And I love that. I love that kind of innovation and that problem solving that happens, and there's so much opportunity to fix
Yeah.
things.
Because there's so many things that are broken.
Yeah,
Yeah.
healthcare is
Won't be the first,
complicated.
won't be the last. Exactly. No, it's
Mm-mm.
complicated, and to create things that are actually implemented beyond just narrative, which another one of my learnings over time. A lot of people, speak a lot about in hyperbolic kind of terms, when in actuality it's like boiling things down to the atomic unit and just working feverishly to kind of create value to, and for us at least with providers, to kind of give them tools that they could actually implement and use that is beneficial, is kind of hopefully there'll be more and more people in this space. And so yeah, it's just it's exciting because there's a lot of opportunity, as you guys mentioned, and in many different facets of the healthcare system.
Yeah, it's an exciting time. I say this all the time, Jeremy. I'm becoming a broken record. This to me, and having been in the healthcare industry, not as a provider like yourself, but just in and around the healthcare industry for almost 25 years. This is, I think, one of the most exciting times to be like actively working in the healthcare industry because of all of the change, technology and AI and kind of the people like you and the companies like yours and the products and the widgets, that are kind of coming on the market, because it's changing everything. It's changing how we access care. It's changing how we deliver care. I feel as a consumer or like a patient, we have more control too. Like we're getting to kind of better dictate what our care journeys, our healthcare journeys look like. I imagine that probably feels the same way from your end as well as a doctor. And are you still actually practicing?
Still see patients on the weekends, so a couple of
Okay.
Saturdays a month. Yeah, still see my
Staying on the
patients.
front lines.
Staying on the front lines. It's hard to give up something that you love. So yeah, I mean, obviously, Picasso's taken over my day and night. Work-life balance like everyone else, but I still try to, at least to the best of my abilities for now, stay active. So yeah, a couple of Saturdays a month.
Okay. Yeah, I hear that a lot from folks that we meet, that still want to stay out there, working with patients, and which is good too, because then it kind of keeps you kind of out there, right? Like kind of seeing what's changing, what do they want, what do they need, just kind of the evolution.
Keeps you in touch with the
Exactly.
whole process that got you there to begin with. Yeah.
Yeah,
Yeah, exactly. Staying close to the problem. So, which will never
right.
be solved.
Yeah, yeah. So just kind of chip away at it. So, what are some of the biggest challenges for primary care doctors? Now, I know you're a specialist,
Mhm.
but in Picasso MD specifically, where you bring this expertise, is obviously delivering specialists to primary care doctors. But I want to talk about kind of like what is the experience today? Like, what's happening? Like, and are there
Yeah.
differences from rural versus urban? Are they geographic challenges?
Yeah. I think over time, more and more is placed on the primary care providers, or I think of entry care providers, right? So back in the day, the only way you could get care was to go to your primary care provider's office, sometime between 9 to 5. And then came urgent cares because of access issues. Then came retail clinics because of access issues. Then came virtual primary care offices because of access issues. But ultimately, primary care providers are on the front line. They get more and more placed on their shoulders. And for them, oftentimes, I won't speak specifically for everyone, but it's an uphill battle just to kind of give thoughtful care because they have so much to do on a day to day. So if you can imagine the complexities of medicine and being able to navigate everything under the umbrella, right? So as a cardiologist, I just deal with one specific issue with cardiovascular disease, whereas a primary care provider can see something from endocrinology to dermatology to cardiology to orthopedics. And so for them, I find it almost an impossible task to kind of problem solve for patients in a thoughtful way when you have 20, 25 patients on your book on your schedule every single day. So for me, it's like if you could just create an easy button where if they ever have a question, like you can get them connected with specialists in under 15 seconds, and they could chat with the specialist in real time. The fundamental question is, would that improve the care the primary care provider could give to their patients? Ultimately, would that result in better outcomes for their patients? And then many times, the next question is, well, great, I don't need to send this patient to the emergency room, but I do need to send the patient out. Navigating the healthcare system as a patient or provider is just as daunting. So having another easy button where we could kind of take over the referral process and find the best specialist for the patient when deemed appropriate. Like if we can just work on that problem, that would hopefully take a little bit off the plates of the primary care providers, make their lives a little bit easier, and ultimately kind of help patient care and total cost of care, which is kind of our ultimate vision at
Hmm.
Picasso.
And
Now,
do you see like with, the we'll say the growth of value-based care, which has changed from, kind of the initial origins of it. I remember back in like 2010, when I was with Aetna, and they were launching their accountable care solutions division, and it was like ACOs and joint ventures, and then there's like patient-centered medical homes and kind of all the things along the the continuum of care. And in terms of value-based care has changed. Obviously, it kind of shows up in different ways, and I know there's like a big push have to become more preventative, right? Like that's kind of one of its core principles. But that means the PCP plays a much bigger role, right? And so you talked about like kind of all the pressures on that on them. Is that part of it because of the shift in this value-based care approach that's being kind of pushed from um, from health plans, from insurance providers, et cetera?
Yeah, there has to be a quarterback. I mean, I should not be managing a patient's care. There needs to be
Mhm.
someone, and that someone should be an individual or a group of, in a practice that kind of is a quarterback of care.
Right.
And so I think value-based care is getting a bad rap, but ultimately the question is, what is it that we're trying to solve for? So as a patient, I would like to believe every time I go to my doctor or the nurse practitioner, whomever it is, to get care, ultimately I'm asking for help, right? So that's the fundamental problem is my value proposition of the patient is can you answer my question? And so if you are able to increase the likelihood of answering that patient's question at the time of you're seeing the primary care provider, well, the patient can walk home with an answer.
Hmm.
And if not, at least having a clear sense of next steps versus, good luck. I'm sorry, I don't know what's wrong with you. Go look at your insurance card and find out where to go next. But having a clear next step and a warm handoff, ultimately, that's what patients want. If you
Hmm.
can boil down a patient interaction that you're looking for an answer or a clear path and answer, and that applies to every single patient office, provider office across the country. So for me, you know, value-based care is just assigning an outcome that aligns with what the patient, the ultimate consumer here in the healthcare system is looking for, which is just what do I do next? And so that is even more difficult. I mean, if we think it's bad in the US, when you start going into more rural and underserved communities, that's when not only is there there's nothing around for 2 or 3 hours. And
Hmm.
if it's available, it's only for a small fraction of the community. So you even the ability to supercharge the care within the primary care offices is more important even in rural and underserved communities.
Yeah, I can actually, not from personal experience so much, but a friend of mine actually is, so we're in Flagstaff. We're not like rural, like you can go into really rural parts, of the state or other, other states, but we still have issues with access to specialists. And so she actually is going to Phoenix for cardiology care, for a cardiologist because she can't find anyone here.
Two
And
and a half hour ride.
yeah, and so in fact, she's down there today, as a matter of fact. So, because she has some heart issues, and it's like, so that access, like we get it, right? Like that rural part is definitely plays a role, in getting
Yeah,
access.
and that's the thing. Flagstaff's like the hub of northern Arizona for being in a rural area. We're very centralized, as it were, but we still have to drive 2.5 hours to get to the specialists.
Mhm.
Yeah.
Yeah,
So there you
So
go. Think the people in Ashfork have an extra hour to drive.
right.
and then you're
Yeah.
going there for an interaction which may or may not be even necessary, right? So imagine taking several days off, several hours off of work, the associated costs with that, the complexity with that. It becomes for most patients a barrier that they're not willing to kind of accept. So if you can kind of reassign where you get care, so there's stuff that you can do in a cardiologist practice as a cardiologist that you can't do in a primary care office. But a lot of what we do can be kind of exported that expertise to the primary care provider setting. So really, only if and when you need to go see the cardiologist are you being sent out, and we kind of supercharge clinical care within the PCP office. That's better for all parties involved, including the cardiologist. Because if I only have 20 slots a day of who I can see, I really want to reserve those for my sicker patients, not for patients who don't necessarily need that care. So, yeah, it's rural and underserved. The more you kind of do it, the more you realize like it is almost an impossibility of care that the PCPs are forced to kind of handle in those clinical settings. It's amazing actually what they're
Yeah.
able to do.
Well, in the patient panels, right, are huge because there it seems anyway like less and less, PCPs that are in even like in the networks, right? Like and I see actually, in fact, one of the NAU, Northern Arizona University here, I'm not sure if you're familiar with this, but I think it was about 2 years ago. They actually are launching and building a program to essentially create more primary care doctors in the state of Arizona through their medical school that they're establishing. I mean, it's brilliant and it's wonderful, and they want to solve for that, like this kind of PCP like, crisis or shortage. But then even still, right? Like you need to give them the tools to still be that quarterback. So,
Yeah,
and so a Picasso MD and what you're doing is kind of plugging into that and
yeah,
giving them some of that access, right? Like some of that convenience and support.
thank you. Yeah, I mean, I think the workforce is shifting from MDs to more, nurse practitioners and PAs,
Hmm.
which is a necessity because it's just the growing population, and in many areas you just aren't going to fill it up with a bunch of MDs. And yeah, I think if you're on the front lines and you have no infrastructure support over time, all it does is kind of just it wears at you. And so this concept of provider burnout is a real thing. So rarely do we ever go to someone and say, actually, how can I make your life easier? Generally speaking, we go to them and say, hey, we're going to add this to your plate. We're going to add this to this plate. And oh, by the way, we're going to pay you less. So, what we're trying to accomplish, right? And we will never get there is creating a workflow, a tool that hopefully, several times a day can be available. So if they have a question, they don't feel isolated and alone. Like, I mean, imagine a world where anytime any specialist related question comes into their office, they could hit a button and get connected with a specialist in under 15 seconds, and hopefully, get dermatology care right at the point of care in their PCP office, endocrinology, cardiology, ortho, whatever it is. Hopefully that will buoy them a little bit and provide a little bit of support that they, desperately need.
Yeah.
And I'm curious the specific workings of that. So who they're hooking up that fast with somebody? Is there somebody just on call all the time for that, or like
Yeah,
how does
we
that
we
actually work in real
that's
time?
that's a great question. We leverage like local networks. So we work with the primary care providers. We say like, oh, by the way, who do you love locally that you kind of have a working relationship with? And if they have them, we kind of get them on as kind of the first in line for evaluation. But the providers go to our mobile or web-based platform. They just choose their specialty, and then it's an algorithm that prioritizes local specialists. Kind of like think of it like a batch request of who's available to help out. And if no one local is available, we have our own network that's from across the country that we've built up
Okay.
through just meeting other specialists who are North Star facing and believe in this mission as well. And think of it almost like an Uber-like algorithm
It
matching a PCP with a specialist, if
like
that makes
it's a
sense.
power in numbers kind of thing. You have enough people and there'll always be someone available kind of thing.
Exactly. And
Okay.
especially specialists, that's I don't want to speak for them as well, but you're getting connected with a provider who has a question that you're a subject matter expert in, and that at the end of the interactions, generally speaking, you feel like you really help someone. And it's a direct communication. So it's a provider to provider communication. So there's a human element to it, even though it's being facilitated by technology. And it's that secret sauce of just being connected with someone and them providing help and you providing help to them that I think has been, a partial reason why we're, whatever modicum of
Yeah,
success we have.
and I
Yeah.
mean people are waiting months for appointments with specialists if they can just get it done right there. That's amazing actually.
Or eliminate the need
It's
to even
sinking
go
in
see
on me
one.
now what we're really talking about. I'm
Yeah,
Yeah.
getting
yeah,
it. That's pretty amazing.
Yeah.
yeah. You go to
Oh,
I
go
was gonna say you go to some
ahead.
you go to some communities and the providers I'll meet with them pretty regularly. I go, how long is it for you to see? Like, what are your pain points? I say, well, neurology is 9 months away.
Oh,
Endocrinology is six. And I don't. It doesn't actually. There's no such thing as like no one is going to get a referral. Like if your doctor said, yeah, I'm going to send you to go see a neurologist next year, the likelihood of you keeping that appointment
It's pretty low.
and waiting 9 months to go see that neurologist is pretty remote. What's going to end up happening is the easy button for you as a patient is what? I'm just going to go to the
Ignore
emergency
it.
room. Yeah, or
Yeah,
ignore it.
Yeah.
Yeah, exactly. So, and
Or go to
if
the ER.
on
Yeah.
top of, yeah, so 9 months away, 3 hour drive, you can send that referral out. It's not going to happen. So, exactly. If you have that patient right then and there, and that's your chance to give care. If you can just maximize the impact you have on that patient, ultimately it's going to result in, less ER visits, less referrals, more satisfied patient and provider base. That's the problem we're working towards, at least.
and expediting the whole system and saving the system that money of not having to keep moving people through, moving people through, moving people through. Get it all done all at once, and yeah, there it's better for everybody.
Yeah.
It's
And the
better for everybody. Exactly.
Yeah. And
Yeah.
the patient experience, like I'm just thinking about what it would feel like if I went to go see my doctor and I said, I've got a questionable mole, right? Like I'm kind of worried about it. And they go boop, 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 Picasso MD to the rescue and connects with the dermatologist right then and there. They maybe show them a picture or they talk through it and they're like,
Exactly.
nothing to worry about. But here, let me refer you maybe for a follow-up, whatever, how that works. Is that kind of what the experience feels like? Because that feels like, to me, from a patient perspective, like I'd be blown
That's it.
away.
It's not I mean, I'm not, it's when people ask what you do, I'm like, it's not rocket science, nor is it that complicated. The primary care provider gets connected with a specialist. They attach images, whatever the files are they want to discuss with the specialist. The specialist reviews it and says, listen, A, it's nothing, you're fine. Or B, you know what? Actually, this looks like it could be something.
Hmm.
So why don't we try X? But you really need to go see your dermatologist. So even if you don't, we use this fancy term called create first visit resolution. Even if you don't solve the problem completely, as a patient, I was like, okay, I'm going to try whatever they told me to try, but I really need to see dermatology. And oh, by the way, they've already helped me with the referral to the dermatologist. That's better than going to see your primary care provider and them saying, I don't know what this is. This could be cancer. You need to go see dermatology. Good luck.
Right.
Right?
Yeah, and you got to wait 9 months to see if you have cancer. That's great.
Yeah, exactly. Or you'll see an EKG and the patient will say, the doctor will say, because they don't know. So listen, it says you may have had a heart attack.
Ugh.
And you as a patient go home and you're now trying to navigate because you think you might have had a heart attack. And you're like, but I feel fine. I don't understand. When in actuality is probably X, Y, or Z, that's very benign, the finding. So just getting the specialist to say, listen, actually this is completely normal or highly likely normal. This may be just from X, Y, or Z, but we'll just get a basic heart ultrasound just to make sure everything is fine. Even if you're still ending up at the cardiologist's office, at least it's coming with a degree of specificity and understanding of why you're going, which is different than just going blindly because of, God forbid, a false positive finding that you may have in the primary care office. So that's the world which we try to live in.
I love it. And I mean, and I have to imagine too, if as a primary care doctor, right, and I say this all the time, doctors just want a doctor, right? Like they want to take care of their patients. They didn't get into into this business to push paperwork around and, figure out how much their reimbursement is. They want to take care of their patients ultimately. And I have to imagine something like this. What how valuable and how good that might feel for a doctor to be like, wow, I really just like I hit a home run on this one. Like I was able to go like all the way to support my patient. So that's
I
gotta
think
feel good.
being advocated for, I think generally should be feel good, right? And
Hmm.
we measure provider satisfaction after every use. So every single time you use a platform, we ask you immediately after, was it good or bad and why? You know, and I take it personally when there's a negative, feedback. I think we had like a 99.5 or 6% positive rating, but there are times when it wasn't perfect. But if the patient provider knows that, okay, if every time there's a negative review, we take it as seriously. I mean, It's like the factory shutting down. We immediately act on it, try to find the solution. I think in the end, providers, any human being, generally wants to feel like they have some support. And I would like to believe that even if there's a shortcoming, if you know that that person on the other end is just working towards making your life better and is advocating for you, then I think there's a level of like acceptance of not everything's gonna be perfect all the time, but it's better than what I have had for my entire training career. And then scaling that as a North Star, like if people could just scale the concept of being able to connect with others and help each other in that scenario over time, it just perpetuates a more positive environment to work, which ultimately results in better care just because you know it's there as a
Mhm.
resource.
You mentioned scale. I am wondering about scalability and how big this could actually get. Because you need the specialists available for, the consultations. Could this potentially, I'm thinking big for you here, but could this potentially be like a true nationwide, it's available everywhere kind of concept? Are there enough specialists for that to actually cover a national scope like that? Like, can it scale all the way up?
Yeah, that's a very thoughtful question. So yeah, I mean, it sounds like one of the problems you have to solve for is the supply side of the specialists. And the truth is, it's like 100-to-1 ratio. So you don't need equal number of specialists as you do primary care providers. And honestly, what you really need are a handful of specialists and scale that handful over time that believe in the mission. It's mission oriented work. Yes, we pay the specialists for this interaction, but there's nothing nicer than ending interaction with "thank you so much. You are the best." Oh my God, my I thank with actual exclamation mark. Like, I know that sounds cheesy, but you're scaling connectivity and being a human, which I think came back to your earlier point of most providers, generally speaking, went into medicine to help other patients and be connected with the community. And the truth is, on the front lines, over time, your world is a computer screen, and the patient, it's less and less about community and feeling connected and maximizing impact. It's more about getting through my notes, seeing my 20
Mhm.
patients, billing. It moves away more and more from the human element. And that's where I think over time, like we are in like 18 states at this point, we have access in all 50. So we will never be satisfied with the scale, but it is something that thankfully we're able to kind of provide as we kind of continue to grow, hopefully.
Mhm. Yeah.
And I'm curious too, and quickly, healthcare is human care, right? Like it is, even with all this digital stuff, like, I mean, technology and AI and having apps and virtual care, it's all amazing, right? Like it's changing the way, well, like just the access piece of it, right? But we still want that human touch. I think that will never go away in healthcare. Like it just won't. Humans need humans to take care of each other.
Yeah, no,
So
nobody really wants a robot doctor.
no.
Nobody really wants that because they don't
No,
understand what it's like to be human and biological.
I think AI will serve great things.
Hmm.
It'll reframe how we provide care. I mean, the reason why I named it Picasso MD, there is an art to everything.
Very
We
good.
always ask about how
Yeah,
names have come to be. So I was going to ask you that. So good. I'm glad you shared that.
yeah.
I
For
like that.
me, the art of medicine, like I'm an average, decent cardiologist. I can come to a conclusion that's probably accurate. Now, it's how you convey that message to someone, whether they actually accept it and incorporate that as the truth. So if you're disparaging, rude, don't convey the message in a thoughtful way, and even though you're accurate, you're giving the right answer, the likelihood that the primary care provider or the patient comes away saying, "I trust in that answer," is low. So I think where everyone kind of comes back to is like, in the end, anything that we say has to be communicated in a way that is absorbed and internalized by the entity on the other side. So for most people, especially at this stage in life, even if they could go to Google and somehow miraculously stumble upon the right answer, if that answer is given to them by a trained specialist who they know and trust, which one of those two is more likely to result in like actual adoption of those recommendations, et cetera. So as much as I love AI and actually believe in it really fundamentally improving care for the masses in many different ways, in the end, you still need that art. So hopefully that's the I obviously believe in that to the point that we named our company after that.
Yeah.
Yeah. That's,
Hey,
the AI can like run the network, but you still
yeah.
need the people at the endpoints of the network
It
for it
has
to
its
work.
place.
Yeah. Yeah.
Exactly.
It has its place.
It-
I want to ask too, like, so, today's experience, and we've touched on this already. I go in, to my PCP or whatever. I think I have a problem. They need to refer me out. Actually, I'm going to use an actual real life example. This happened to my son.
sure.
In fact, he needed a pediatric cardiologist. We had gone to his pediatrician because that's where you start, right? And he was having like heart things going on, like as he called them, my heart just beeped. That's was the way he described it. And so we had to then get a referral to a pediatric cardiologist. There's like one in Flagstaff. So of course it was literal like 2 months before we could get in. And so meanwhile, all of this is happening, which is scary, as a mom, like I don't know what's going on. And so it was like waiting, right? And then we got in to see him. I mean, he was an amazing doctor. Um, and we created that relationship with him. But had my pediatrician had Picasso MD, and we went in there, and they were able to call up a pediatric cardiologist and say, yeah, no, that's pretty, urgent, or, not totally worried about it. But either way, whatever the answer is, how does it show up for my actual cardiologist once we get into the office? Like, do they get the notes? Do they have this context when we walk in the door, which I imagine is so helpful for them, right? Like, that's even less time that they have to spend trying to ask us what happened and this and that, right? Because there's like clinical information being handed to them that's got to make their time even more efficient.
Yeah, I think the purpose of the communication is not to solve all the world's problems. Like
Hmm.
first visit resolution, if it's possible, is great. That's what we shoot for. But in this scenario, right, the pediatric cardiologist may have said, well, these are the three things that he or she, the pediatric cardiologist, is going to want to have done. And of these three things, these are the two things you can do while you're waiting, right?
Mm.
Get this blood work done. You may need a 1 week monitor. Go ahead and put that down so we have those results in hand.
Mhm.
And so the your primary care provider kind of has a game plan in hand. Then we transcribe the communication to a note. So everything that happens gets transcribed and passed to the PCP. But then the PCP now has the two bits of information that he or she could have gotten completed done before while waiting for the consult, and the recommendation from this pediatric cardiologist, and that gets sent to cardiologists. So by the time they arrive, the vision is that they have had whatever that could have been done with some semblance of understanding of why the patient's there. And the purpose of that communication is also to triage. Like, is this a routine visit? This needs to be seen sooner than later, or no, this is actually emergent. You need to send this patient, for instance, to the emergency room
Mhm.
for next steps. So yeah, all that documentation is part of the value proposition that we offer.
Got it. Yeah, that's great.
That's great streamlining of the process. It really is.
Yeah, and there's not that time where you're sitting there as a parent or just yourself. If it's you and this, like, you know, I don't know what's going on, right? Which is scary when there's something troubling you health wise. So to have
Yeah,
some kind of answers, like that's,
it's not maybe not solve all the problems, but as a parent, 3 children of my own, understanding what I'm dealing with and understanding the importance of that, I think
Mhm.
is better than having no context of what's going on. And
Yeah.
hopefully, I'm
And
Yeah.
sure your son is doing well.
yeah, actually,
Yeah,
he did wear one of those monitors. He actually ended up wearing one for a whole month. Um, and anyway, it just kind of stopped.
yeah, probably just skip beats, but you never know. But you have
Yeah.
to rule out something more scary. But
Yeah.
until you rule it out, you don't. As a mom, like there's nothing scarier, right? So
Right. It was. That was a yeah. I'm like, my kids are healthy. They've never had any issues. I'm like, what's going on here? But
Yeah,
yeah, it was
exactly.
definitely Picasso MD would have been great.
I
Should
would
tell
I would
my
like to have thought your pediatrician exactly. My wife's a
yeah.
pediatrician. So she uses it for Pete's cards all the time. It's one of
Oh, I
her
love
favorite
it.
specialties.
Well, you know where I'm going to take all those water bottles. I'm going to take them to Mountain View Pediatrics here in Flagstaff
I love it.
and
There you
say,
go.
if you're not already using Picasso MD, you really should. Here's a nice mug.
There you go.
Gonna
Yeah.
sweeten the pot here a little bit, but and actually that's one of the questions I wanted to ask you too. Obviously, you've got a lot of specialists that are part of the Picasso MD network. Is it pretty much kind of across the board? Are there certain ones that maybe get used more often, or maybe even see more benefit just simply out of utilization?
Yeah, and I think we have 30, a little over 30 specialties to kind of choose from, but bread and butter kind of medical and surgical specialties and subspecialties. But yeah, there are definitely centers of gravity. We have more dermatologists, endocrinologists, cardiologists than we do neurosurgeons and cardiothoracic surgeons because it just doesn't come up as often.
Hmm.
Um, and we just scale up over time depending on the demand from the primary care setting. But um, I think those certain specialties are even more difficult to access, especially in rural and underserved markets. So any what I call non-procedural based specialties. So finding an endocrinologist or dermatologist, a neurologist, infectious disease, rheumatology, these kind of specialties is near impossible in certain markets. So us being able to be at least a partial solution in those markets is kind of a tremendous value proposition. But yeah, I think things that kill you and things that are common are those scariest. So like cardiology is the most very commonly used just because people are nervous, which
Hmm.
and rightfully so. But other specialties are center of gravity as well. So like derm, endo, neuro, etc.
Hmm. Yeah, that makes sense. Yeah, I'm thinking about, ironically, I like to use my own personal life examples in the show often. I'm like the startup like app poster child for so many different companies. Um, but I literally needed a dermatologist for something once, and I could not get into my dermatologist up here. It was like 4 months. And so they're like, oh, we have another office down in Verde Valley, which is about an hour and a half drive. And I could get in really quickly. And you know what I did? I didn't go. I canceled the appointment. I am like typical, like exactly what you explained. And
You're statistically
I
accurate.
am. I am a statistic, and I consider myself a pretty, I'm on top of my health. I don't have transportation issues. If I can take a half day off of PTO, right? And I'm not losing any money. When I think about people who don't have that kind of capability, like I have a
Yeah,
privilege,
if you didn't have a car, think about if you didn't have a car.
right? And I could have gone.
And
Like it was just me being, you know, I don't want
yeah,
to I don't want to go that far,
wait, and especially if you're underinsured, or uninsured.
Hmm.
What does that population do? I mean, if
Right.
some people say, "Oh, so it's just a $40 copay," well, that's not a $40 copay and 3 hours off work is a big deal for many, 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 many Americans. And
Right.
until we value that as much as we value just the care for those who can, like the goal is to be able to create true health equity. How do you treat equity if access is only provided to those who can afford,
Hmm.
and even and people who are actually leveraging their care is only those who can actually afford it? That dynamic creates those who have and those who have not. So hopefully
Hmm.
that's where we spend a lot of our time and energy, is working with kind of underserved communities and helping provide access to care that they normally wouldn't have that access to at all. So that's kind of our
Yeah.
Yeah.
proudest work, actually.
Yeah. I imagine and I'm totally invested into equity. I've worked in Medicaid and Medicare across the years and rural America, having it currently. And it is an equity issue and it shouldn't be like I said, I have privilege to get myself to a specialist 3 hours away if that's what I want. There's a lot of people who don't have that choice, and it shouldn't be that way. It
60
shouldn't
million.
matter. Yeah.
I
Yeah.
mean, especially with technology now, you're proven right here that we can solve the problem with
Hmm.
the tools we now have.
Yeah.
Yeah, I mean,
Um,
60 million Americans live in underserved communities. We work with many FQs from across the country, and again, the amount of stuff that's put on the providers at the FQHC levels, and they're trying
Hmm.
to provide care to their patient population who are trying to access care, and it's kind of shocking and honestly very humbling. As you know, when I first started, I live in DC, so to your point, like I have access and I'm
Hmm.
somewhat connected to the community. But then when we start going just a little bit further out, right? We have a strong partnership in Maine or Mississippi or actually in Arizona. It's the same problem, just with different shades of flavor of lack of access, especially for those who have less financial means than others. So, yeah, that's something that we will dedicate ourselves to the to the very end is trying to helping scale access to those who need it most.
Yeah.
FQ?
I was going to ask you too if you were in the FQHCs, that
What does FQ mean?
federally qualified health center. So like North
There you
Country
go.
Yeah,
up here.
Gotcha.
That's one our big FQ up here. Yeah, and I was thinking, gosh, you have to be working with a lot of those. That's like
dozen.
your audience right there.
Yeah, dozens. Yeah, and again, the proudest work because it's
Yeah.
and honestly, in many ways, the best providers I've ever seen are people who have the less resources you have, the more you have to be able to do yourself. That just
Hmm.
inherently creates like a value proposition. I have to be really on top of my game. So yeah, I love our work with the FQHC communities. So yeah, we work with dozens and dozens from across the country, which is amazing.
That's great. And when your providers that are using the Picasso MD app, what do they say? Are they like, "Oh my God, I wish I had this 10 years ago?" I mean, I'm sure it's raving
Yeah, I
excitement.
mean, generally speaking, it's very positive, and but still, in the end, like they still have to be able to take time to engage, even if it's matching them in 15 seconds. Like sometimes they're just busy and cranking and they don't have time for it. But as a whole, we measure all this stuff. It's been overwhelmingly positive, and that's
Hmm.
why we've lasted for nearly 6 years at this point.
Okay.
Because in the end, we're ultimately like just all I want to do is support that person on the front lines as to the
Mhm.
best of our abilities. So we just take the feedback, anything negative that comes across, try to learn from that, our shortcomings and apply that and improve. But yeah, I would like to believe that when I was a young doctor and I was walking around trying to give care, if I could just anytime I had a question, I could just get immediate answers. I think it would help me provide better care. So I would like to believe that they're generally satisfied, which is great.
Yeah. And do you ever have any like patient testimonials, like feedback where they said, "Oh my God, this was life-changing," or I'm curious.
Yeah, we don't directly engage with the patient, but
Right.
they speak about their experiences to their providers who then kind of reach out to us just because we do try to pass forward like every interaction is reviewed and rated and every single thing that's positive we actually forward like every positive interaction or feedback report to the specialist and similarly our providers do that as well so internally we have a whole user testimonial channel and like one of those positive feedbacks that you get from a patient said, I would never have been able to receive care other than through your platform.
Mm.
Like that's fuel for the year. Like it's amazing. That's the only reason why we still continue to do what we do is just because of that level of feedback.
Hmm.
So yeah, patients who generally give very positive
Yeah.
feedback to the providers who then forward it to us for our own consumption.
Yeah. You're changing lives. You really are. You're impacting people's healthcare journeys and their experience, right? The patient experience, and so improving it.
And
Uh,
I always see connections in the ether when we do these episodes. I'm thinking of Guava Health right now, and if you combine the Guava Health concept of, consistently and instantly updating your medical records and having them accessed through an app on your phone all the
Hmm.
time with something like this, where you go to the doctor and they immediately connect in with the specialist who then updates your record from the specialist side. And then you have guava that you can go to the doctor and another doctor and be like, here's what all these other doctors already did and said.
Uh-huh.
And I mean, the tools that are being created for not just the patients, which we do a lot here, but also for the providers. And then you add Seth in there. I forget
Wellbe
his
Health.
Wellbe Health
Yeah.
to do your paperwork for you. Like if you get the right set of people that we just what we've had on this podcast so far working for a provider, they can spend all their time doctoring.
Yes.
Like it's happening.
Wouldn't
I'm
that
seeing it in real time right now.
Uh-huh.
It's just a matter of letting people know that these products are out there.
Yeah. Yeah.
Yeah, I mean, it's unfortunate. All those great companies, Wellbe and Guava and Picasso, I'll just throw that for conversation purposes, exist because there's so much wrong with the system.
Right.
Yeah,
Yeah,
so
everybody's
like,
solving another specific problem. And if you can get them all to get, if you can solve all these problems and then use them all together, then no more problems, right?
uh,
No more problems.
that's it.
Maybe
We're
I'm
done.
daydreaming, but
That's it.
I mean, this whole thing, and Heather said it earlier, this is the best time. Like she's never been so excited to see all the cool innovations going on.
Hmm.
That was like her initial pitch to me to start this podcast. I didn't believe her.
Well,
I really didn't believe her.
we're building a new
Now
ecosystem.
we're like 30 episodes in, and I'm like, wow, this is really cool.
Hmm.
Like you were
There,
totally right. Like you almost undersold it to me at this point.
Not
there
anymore.
are
But
pl
yeah, it's building the new system. It's building a new ecosystem,
Yeah,
right?
yeah, like a new medical ecosystem. It really
Yeah.
is.
there are
It's cool.
plenty of
And
great
this sounds like
people.
a big part of it.
Well, I don't know about big, but we're trying our best. I think there there are plenty of people who do things for financial reasons, and there are plenty of people who do things or organizations that do things for North Star reasons, right? And so
Mhm.
getting that to your point, that marketplace of understanding who those individuals are that are working just like for pure, right? It's not about exits or it's about making differences in providers' lives and patients' lives and just dedicating, like I told our co-founder and everyone else is like, I have about 25 more years dedicated to this mission. Like whatever framework or flavor that is, it's kind of like a artisanal thinking of like, I'm going to commit to this problem regardless of how I try to address it. Now, obviously at this point it's with Picasso, but like it's that singular focus on positive impact. And if you can get enough of those people working together collaboratively and just everyone leaves their egos at the door and it says, I'm a partial solution to this problem and I can leverage the knowledge of Guava Health or Wellbe Health and kind of over time that will be the ultimate play is kind of creating that centralized marketplace where collaboration happens to solve things in a much more holistic viewpoint. So I couldn't agree with you guys more.
Yeah. Yeah, it's a it's a great time to be alive. Healthcare is just full of caring, kind people, and I think it's why I've stayed in this industry and want to not leave because people that work in healthcare really are the most loving, kind, caring people, and really just want to change the world, right? They really want to have impact on their one little piece of the universe, you know?
Yeah,
And
that's it.
yeah, I'm here for it. I'm here to stay. I'm not leaving now.
I love it. I can't wait to hear your other podcasts.
I know. I have to bring more to the world. Um, so as I'm just checking the time here, so we start to kind of wrap up here. But you had mentioned, and I just want to talk a little bit about kind of where's Picasso MD going next. You said you're in 18 states, right? But access
Yeah.
in all 50, is that right?
Yeah, so we kind of created the platform in a way where we can go anywhere that a market needs us
Hmm.
immediately. So it's just a matter of, we don't really advertise or generally speaking, our growth is purely word of mouth.
Hmm.
People who are looking for this solution or looking for a partial solution in this direction are us working with them like to hopefully address their concerns. So like, yeah, I mean, we started in DC with 3 providers and thankfully now we're in many different markets and all this has been just kind of organic growth and opportunity. So yeah, and anyone that needs help, we're happy to try to scrub in and help.
It's an easy sell. So yeah.
You said you were in Arizona already?
Yeah, we work with a couple of organizations in Arizona, hopefully another very large one June in the next couple of months. But yeah, we work with a couple of FQs in Arizona. A lot of great medical care, but geographically speaking, it's an interesting state where, to your point, there's like centers of gravity of care.
Hmm.
So in certain pockets, you can throw a stone and get a doctor, and others, you're talking a 2.5, 3 hour drive.
Yep.
Right.
So
Yeah,
yeah,
if you're in
been out.
Phoenix, there's hospitals everywhere.
Exactly, exactly. So no, we're in Arizona now. Yes, currently.
Yeah. That
Cool.
that's how we met.
Oh,
That's
that's
Oh,
right,
okay.
actually.
through
Yes.
Equality Health, right? Yep. Yep.
Yeah.
How do people get you into their market? Like, can someone go to their doctor and be like, "Hey, are you working with Picasso?" Kind of thing? Like, can
Um,
people poke at their doctor or
they could, but we generally partner with like either payers or ACOs or value-based organizations, so that's kind of one network of groups that we work with, and we work with a lot of rural and underserved community settings. So a lot of FQs, so either through their kind of state level partnerships or directly with FQs themselves. So um, yeah, I think it's more about
the bigger
the organization,
networks?
the bigger, exactly. Yeah.
I gotcha. I mean, that makes sense. You cover more space a lot quicker that way, right?
Yeah, but
Yeah.
one provider at a time.
Yeah.
Yeah, sure, sure.
That's amazing. Well, anything kind of big changes that you are coming or just kind of trucking along and just looking for that growth?
Yeah, we're kind of iterating off of like some feedback from the providers of us being able to kind of get that specialist feedback directly from the referrals and kind of making it even easier and easier over time to make lives easier for the primary care providers. So, nothing, there's no silver bullet here. It's just kind of iterating over time with things that
Mhm.
work and continuing to get feedback and learning. So
Yeah.
hopefully in 5 years we can do this again and we can kind of share notes on how things have improved. But like ultimately it's just every day that we're in this fighting towards a path that we believe in is a blessing. So
Yeah.
just fighting the fight.
I love it. Well,
Hopefully 5 years from now we'll be in a real studio.
I
yeah,
like it. I like
Fancy
this studio.
screens and stuff.
Yeah.
pretty good. It's pretty homey here.
I love it.
Well, awesome. This has been a great conversation, and I thought I knew a lot about Picasso MD, having worked with you in the past, but I learned so much more today, and I really, really hope that I walk in to a doctor's office at some point and I will be so giddy happy when they pull out their phone and pull up Picasso MD. I'll probably be like the total weirdo and I'll like selfie myself and then I'll send it to you and be like, "It's here. I'm getting I'm getting access." I mean, also like I maybe don't want to have to need a
Yeah,
specialist.
exactly.
Yeah. Careful what you wish for.
Yeah,
Well,
right, exactly. But at the same time that would be kind of cool. So
that would be kind of cool. Well, we'll keep working towards that end. But I appreciate the time today, and honestly,
yeah.
thank you for taking the time to connect with us. And it really does mean a lot. So thank you.
Yeah,
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 thank
I
you.
love and also just to plug you really quick too, to learn more about Picasso MD, go online picassomd.com. Probably best
Yeah,
place to start.
Cool.
exactly. Yeah,
Perfect. Yeah,
both
learn
there.
more about the good work that you're all doing. So, well, thanks for coming
Appreciate
on
it.
today. This has been another great conversation and I learned even more about
All right.
the awesome impact that you're having.
And there you go, our conversation with Reza Sanai from Picasso MD. Very cool stuff. Yet another really cool, I don't know, I guess just an expediation of the healthcare process. It's
Yeah.
kind of one of the tracks we've been following here at the Uprising. But what are our main takeaways from that, Heather?
Yeah, I mean, like I said, in the show and in the intro too, Dr. Reza Sanai and I got to work together at my previous job, and I was just really blown away by what they were doing. And we talked, extensively about, access issues in rural and underserved communities, which is clearly where they definitely show up. I think more that makes sense for them. Um, and literally showing up in the palm of a PCP's hand when they have their patient sitting in sitting in their office. I mean, it's just to me, this is like the epitome of innovation, right? Like
Mm,
this, this is what the uprising is all about. It's people like Reza and his co-founder, founders or co-owners or co-presidents, whatever their names are and titles. Um,
Creators, I
his
think maybe they are
his
called Picasso MD. I'd call them creative.
yeah, his partners in this, they are showing up to answer a problem that has it's not a new problem, right?
No.
Like there has been a lack of specialists in rural and underserved communities for a really long time. And like he said, like PCPs are getting more and more burdened, right?
Yeah.
And so our goal, I think, as an industry, right, as the healthcare industry, really needs to make their jobs easier and let doctors doctor.
Yeah.
And Picasso MD is just doing that. And I love I love it. I love it.
Yeah. I said that a little bit in the episode, how you put the right combination of these things together and the doctors can spend all their time doctoring.
Yeah. Yeah.
But
This ecosystem, right? We talked
yeah.
about that too. What's happening in the industry right now is that these really smart people like him and many others that come on the show, they're building a healthcare ecosystem for patients and providers.
And providers.
Um,
Some of them even for insurance companies.
yeah, that actually works.
Yeah.
That actually helps achieve healthier outcomes because that's what we want. Keeping people well, making sure things don't get worse, getting them to the right point of care that they need when they need it.
Yeah.
That's what we want.
You're at your primary care provider and they say, you're going to need to get checked out by a specialist.
Hmm.
And instead of saying, here's a phone number, give them a call and maybe you can see them sometime in the next year,
Bye and good luck.
they go, you need to be consulted by a specialist. Give us a minute. We'll be right back.
Boop, boop.
And it's art and boom, done.
Yeah, I
You
love
got
it.
your consultation from a specialist. You know if you actually need an appointment or not. You know what to do before the appointment so that you're ready for the appointment in a way that they can make the time count once you do go.
Hmm. Yeah, it's brilliant.
It is. It's brilliant. And in all episodes
It's
like this that
simple.
we do, I'm like, why didn't we do this from the beginning?
I
But the
know.
real thing is the technology wasn't there.
No, the
But now the
technology.
technology is here,
Yep.
and it's good to see people who know what the real problem is and have a real approach to solving it because they have the tools now.
Yeah.
The tools exist. This is a real thing
Yeah.
that they can instantly connect or, close to instantly connect a specialist to a provider in real time
Hmm.
when the patient is sitting there and they can in real time do that initial consultation in the same room that the patient's sitting in to see their PCP.
That's life
It's
changing.
been like a whole year's worth of process.
Yeah.
You're getting a year's worth of process done in 10 minutes.
As much as I don't want to see Picasso MD show up in one of my appointments with my doctor, I also do because it would be great to know, like,
Yeah.
well, this is so cool, right?
Yeah.
Like, someone's looking out for me.
Like
So
with you were talking about with your kid's heart thing, like how much would that have helped?
it would have been great.
You might have been gone through that process in a day.
Yeah.
Maybe, you know what I mean?
Yeah.
Like
Exactly.
it's crazy to think of how much this could really expedite the entire healthcare system.
Yeah. This is
'Cause-
efficiency
Yeah,
right
because
here.
think about how much it frees up the calendar. The reason those specialists are booked 9 months out or, 3, 6, 9 months out is because they are having to see everyone in person.
Hmm.
If they could do a dozen of these a day, that's a dozen appointments they don't have to do in the future.
Right. Avoiding all of that potentially.
Yeah.
Yeah. That's pretty great.
Like it cleared, one day of those, which can be done in the midst of actually doing their regular day,
Hmm.
clears up a whole day worth of patients later.
Yeah. Crazy.
It's like they're able to, it's cutting it in half. Like their actual in-person visits can get
Hmm.
effectively cut in half, maybe.
Future of healthcare is here.
The more I think about it, like I'm just realizing this stuff as I'm saying it. Like the more I think about this product, this Picasso MD thing, like
Yeah.
the more I see how much it could really help the whole system. It's
Hmm.
pretty wild.
Yeah. Yeah. It's exciting. So
Huh.
anyway,
Good stuff. That's why we call it an uprising.
that's why we call it an uprising.
If you want to make sure you stick around and check it all out, make sure to hit those happy little fun buttons before you go. The likes and subscribes, the shares, the auto download on the audio platforms is key to keep track of the uprising there. We're also on video on YouTube. We got video on Patreon, patreon.com/healthcare uprising. If you want to monetarily support the uprising, that's the place to do it. I think that's all I say. What do you say, Heather?
I say a few things. Go visit us on healthcareuprising.com, but especially find us on social media. We're on Facebook, we're on LinkedIn, we're on Instagram, and we are on Blue Sky. So follow, like, subscribe, whatever each platform tells you what to do. But we post out there when our episodes drop. We post reshare posts from a lot of the companies and people that come on the show. So great place to kind of stay in touch out there and what's going on in the healthcare innovation universe. And if you have a story, if you have a business, if you are doing something really cool and innovative, and innovation shows up in a lot of different ways, give us a shout. We'd love to bring you on the show. Email us at healthcareuprising@gmail.com, and we would love to have you on. So that is your dose of healthcare uprising for the week. Excuse me. And with that,
You got a frog in your throat.
I do. With that, keep looking for the good in the world, because sometimes it's where you least expect it.
Ribbit. Excuse me. This has been a Shut Up production.
Shut up!